Okay, hi everyone. I'm going to start the session. It's 12:35 on the dot, and I want to be mindful of everyone's time as people are moving in and out of different sessions. Thank you so much for joining. This is the session on how DEI can influence healthcare. Yahar, if you could please start the slides. You may have been to other sessions that had, presenters and fireside chat style, but it's just me presenting. So we'll be talking today about diversity, equity, and inclusion in healthcare. My name is Okafor. I'm currently the Chief Diversity Officer and General Counsel for the American Board of Surgery. So that's the organization that nationally certifies general surgeons. So anytime you hear I'm a board certified surgeon, that's what we do. And that just means the surgeons have passed particular rigorous exams. They've kept up with their medical licenses and all those requirements and have met certain rigorous standards to be called a board certified surgeon. So I'd love for this to be as interactive as possible. If you have questions, please put them in the chat. There'll be some time at the end for questions. Next slide, please. So a little bit about me before we get started. I was born in Nigeria, raised in the UK, and then I moved to the US as a teen. I went to college in Texas and then went to law school in Washington, DC. I practiced law for several years, over a decade with international and national firms specializing in ERISA, employee benefits, executive comp, retirement, and healthcare law. And then I moved to the American Board of Surgery a little over a year ago. And as the General Counsel and Chief Diversity Officer, I'm actually the first person of color to hold these positions in the organization's 85-year history. I'm also the daughter of a doctor and a nurse. So I've been in healthcare pretty much all my life, though not actually, myself practicing, but have been around doctors and nurses my whole life. I'm also a military spouse. I'm married to an engineer and a soldier in the Pennsylvania Army National Guard. And then I'm also the mom of two little girls who are 4 and 2. And so I tell you all these things about me just to give you some insight into how I approach my diversity work, my lived experiences and the different lenses I bring to this work as a Black woman, an immigrant, a first-generation American, a lawyer, a DI strategist, a military spouse, and a mom. Next slide, please. So the purpose of today's presentation really is, the heart of the question is, why should healthcare organizations take diversity, equity, and inclusion seriously? The short answer is to be able to hire and retain a workforce that is representative of the patient population and thereby improving patient care. And when people think about DEI, sometimes they have a very narrow view, oh, it's just race or gender, but it's so much more than that. And it really stretches to include every layer, every spectrum you can imagine. But at least in the healthcare space, we're also talking about diversity of thought and diversity of medical techniques and practices that might be different from what are currently accepted processes and medical standards at this point. And so by really focusing on the range of diversity, equity, inclusion within the healthcare space, it will help broaden the practice of medicine, push innovation, redefine approaches to medical techniques, improve patient care, and the quality of life for patients and their families. So there really is a lot at stake for healthcare organizations, and that's why they should be committed to DEI and take up space and take up room within the diversity space. Next slide. So just a quick agenda. We're going to start by just level setting, defining terms. I think it's always helpful. I never assume that when I give a presentation that people know what I know or that I know what people know. So I'm just want to level set and define some terms I'll be using. We'll talk a little bit about the current state of diversity, equity, and inclusion in the healthcare organizations. We'll talk about risks for lack of DEI in healthcare. And then on the flip side, the benefits of DEI in healthcare. And then we'll talk about strategies that organizations can consider to promote DEI in the healthcare space. And then we'll conclude with takeaways. So just to level set, next slide, please. I'm going to be using some terms interchangeably, but I'm really trying to just refer to the same thing. So I might say healthcare organization, hospital, medical institution, medical center, but I'm really just talking about the entity that's providing comprehensive care to meet the healthcare needs of patients. Similarly, if I say healthcare providers or healthcare workers or medical employees, again, it's really just talking about people that are providing medical care treatment. And so that's including doctors, nurses, midwives, radiologists, technicians, really just the whole spectrum of people that work in the healthcare space. When I talk about diversity, I mean the range of human differences. So again, I mentioned earlier, it's extremely broad. We talk about race, ethnicity, gender, sexual orientation, social class, physical abilities or attributes, national origin, political beliefs. When we talk about inclusion, I mean giving providers as well as patients a seat and a voice at the table to provide and receive high quality care. And then when I talk about equity, I mean when providers have what they need to do their jobs effectively and patients have what they need to have the best possible health outcomes post-care and post-treatment. Next slide, please. And I felt this next set of terms was important to define because you really can't talk about diversity, equity, and inclusion in the health space without mentioning health equity, health inequity, justice, disparities, and social determinants of health. And so health equity or inequity being factors like education, income, gender, environment that would cause unfair differences in people's health. Equity, meaning that everyone has the opportunity to be as healthy as possible. When I talk about justice, it's removing those systemic barriers that prevent people from accessing healthcare, removing those so that people don't need the support or accommodations anymore. A disparity is a preventable difference in the burden of the disease, injury, violence, or opportunities to achieve optimal care. And then social determinants of health are places where people live, work, learn, and play, and these can also contribute to health inequities. Also wanted to highlight a bit of a difference between the healthcare space and the public health. And so public health really is focusing on the broader community, promoting health through entire communities and populations. While healthcare, we're really focusing on treating and diagnosing individual patients. So I have a friend who's a doctor in public health, and she thinks of it as, public health is really focusing on people before they're patients. Focusing on the health of people before they get into the healthcare system and become patients. So I thought that's a really helpful way to think of that. So next steps. So the current state of DEI in healthcare, as everybody knows, the COVID-19 pandemic really put a spotlight on what we already knew, and that was significant disparities exist in our country. And those health disparities exist between ethnic groups based on gender, zip codes, ability, status, education, just to name a few. And so in response to these, highlighted disparities, a lot of health systems launched diversity, equity, and inclusion programs. They hired DEI officers, they hired health equity officers, they published equity statements. But really 2 years later, we're not really seeing the efforts translate into tangible results from a lot of those initiatives that were first spurred during 2020. Additionally, there's a lack of diversity amongst healthcare leadership. When we look at diversity data, the tendency is just to look at the whole pie and just say, okay, we have X number of Blacks, we have X number of Asians, but when you start to stratify the data, you'll start to see that, a lot of people of color are at the bottom of that healthcare ladder. Whereas when you get to the top with executives, chief medical officers, the CEOs of healthcare systems, you're really seeing it become more homogenous, more white, more male. Similarly, there's a lack of diversity amongst healthcare professionals. You can see that chart there. Most active physicians today are white. And the majority of nurses and therapists, although they're women, when you look at who's represented there, people of color are still vastly underrepresented in this area. And so I found a really interesting state of diversity, equity, inclusion healthcare report that kind of surveyed over 1,000 healthcare professionals. and they were giving feedback on some of the organizations they worked with. And 62% that their organizations have some type of DEI initiatives, but they also mentioned that only 40% have DEI training requirements for managers to participate. And if we all know anything from working in any type of an environment, the managers really are key to determining whether someone is going to enjoy their work experience or hate their work experience. So that was a bit of a striking contrast statistic there. But promisingly, 90% of organizations say they do support DEI initiatives in some form or capacity training. So it's moving that support to actual action is what we'll be talking about. Next slide, please. So some of the risks for the lack of diversity in healthcare, and I split it up between healthcare providers and patients, because I think that's a really important distinction. So for the providers, the doctors, our nurses, our technicians, when there's no diversity or there's a lack of diversity, they are going to feel targeted, maybe for speaking their mind, raising concerns, maybe ostracized, disempowered, undervalued. They're going to feel disengaged. You know, there's this phenomenon on social media right now talking about what quiet quitting is and isn't. But really the heart of that is disengagement. They'll feel more levels of burnout and exhaustion. They won't feel psychologically safe and able to bring their authentic selves to work. They may also harbor implicit racial and ethnic biases that haven't been exposed because there hasn't been any training to help them mitigate that. And so that will definitely impact patient care. And because of that they could provide subpar care to patients. We think of the scenario where Black patients complain about pain and maybe white medical providers don't believe them, or somehow believe that they can tolerate more pain than their white counterparts. So this lack of representation also leads to a lack of creativity, a lack of ideas and perspectives. And again, that's going to impact the quality of care patients receive. And if it gets to a point, these providers don't feel included in their healthcare institutions, they're going to be more vulnerable to leave the healthcare organization or healthcare altogether. And on the patient side, we know, and I talked a little bit about this with the COVID-19 pandemic, people with diverse racial and ethnic identities have unfavorable social determinants of health, such as lack of access to high quality education, housing, and food. And also people of color experience greater incidence and more severe cases of disease compared to white people. So these disparities are going to, work towards feelings of distrust. Some may not seek care early, may not seek care altogether, or when they do seek care, they may not follow post-op recommended treatments because there's a level of distrust with the medical system and medical providers. They may feel less satisfied with their interactions with healthcare providers, and they may experience those biases we talked about earlier from providers. So really, there are a lot of negative implications for when DI is missing from the healthcare space. Next slide, please. So we'll talk now about some of the benefits of DEI in healthcare. When healthcare organizations create high quality, impactful DEI initiatives, they foster inclusive work environments where employees feel valued and they feel a sense of belonging. They demonstrate to employees that they understand them as people first, and they don't separate their employees as people from their work. People are not considered just another cog in the wheel. It creates a strong organizational culture that will attract and retain qualified and engaged healthcare workers who are going to provide care to patients. They're going to empower their employees to deliver inclusive, person-centered, culturally competent care. For instance, maybe there is an Iraqi woman wearing a hijab who's seeking care, and she might appreciate if there was a female doctor who would understand, the cultural and religious aspects of that, maybe draw the curtains and take other steps to prioritize her modesty. So when providers understand those cultural sensitivities, then they can respond better to patients. It's also going to improve patient safety and satisfaction, which will again help increase chances of better health outcomes. So when patients feel comfortable, their guards are down, they can comfortably talk to their healthcare providers, establish a good rapport, give the full medical history and not hide parts of their medical history that could actually impact their treatment. But if there's poor communication or lack of trust, that might even lead to misdiagnosis on a provider's part or a patient misunderstanding their post-op treatment plan. So it's really important for there to be, a good level of communication and understanding between patients and providers. And just generally, it's going to reduce low morale, disengagement, burnout, and turnover among staff. Next slide. So we're going to now switch and talk to strategies to promote DEI in healthcare. When we talk about bolstering DEI efforts, a lot of healthcare organizations are, they say that they want to do that and understand the importance of it, but then there's a difficulty in actually implementing that and where to begin, and there's also a misunderstanding, when healthcare organizations discuss DEI, what they think they actually need to achieve, those are almost like two ships passing in the middle of the night. They're not really connected. So while there is awareness and intention there, the path towards achieving DEI can remain unclear. And so these strategies that I'm going to go over will hopefully help healthcare organizations consider their approach to DEI. This is definitely not exhaustive, it's not exhaustive, it's illustrative, but at least it's a start for organizations to start thinking about ideas for DEI. And if you don't see a strategy here listed that you think is really important, please include it in the chat. Next slide, please. So the first strategy is to know your baseline. I think the huge mistake I see with a lot of companies is that they just want to jump headfirst into DEI without assessing their own organization first. And I like to think of it as like going grocery shopping without checking your pantry first or your fridge or making a list. You just show up and you start shopping. Most people are not going to do that. They're going to take stock of what they have at home before they go out so they don't get things that they don't need. And so I think that that's the same approach when organizations want to start their DEI efforts, is to really take a step back and assess and get a feel for the current culture of DEI and examine what needs to be done going forward. So an example of that could be a DEI audit. You're looking at your people, your processes, your frameworks, your strategies, and gaining valuable insight into what systemic barriers or cultural barriers are there that are going to impede the company's ability to attract, retain, and recruit diverse talent. Another thing would be to ask questions. That asking questions is a great way to identify the needs of underrepresented groups to provide them with the right support. So maybe you ask the question, what factors affect the ability of our employees to achieve their potential within the organization? And after you ask those questions, the next step should be to seek feedback from employees through surveys, pulse checks, focus groups, town hall meetings. But it's paramount that you've created a safe environment for dialogue without the risk of penalty or adverse consequences before you ask for this feedback. Next slide, please. You want to collect and analyze demographic data. That's key. Tracking and access this data to understand where there are gaps that need to be filled in recruitment, development, leadership, employee engagement, retention. I do want to point out, as a lawyer, I have my lawyer hat now on, that there are legal considerations to consider when you are collecting and analyzing this data. So at this step, it would be important to work with legal counsel to gather and protect this data and determine if anything needs to be done just to keep this data secure. Next slide, please. You also want to reevaluate your business processes. So you've gathered your feedback, you've gathered your data, and now you want to turn the focus on rules that guide the organization and its culture. What are your business policies and practices? Are there places where you can eliminate those policies and practices that are hindering DEI efforts. You also want to review business practice. It's important to understand, again, whether there's bias there. For instance, your job postings, is there unintended bias in your job posting language that would alienate certain groups from applying? Because if there is, then maybe the most qualified person won't want to apply because they're deterred by the language that you use. So it's really important to really reevaluate your business processes and practices and policies with an open eye, with an eye that's not clouded. You shouldn't be afraid of discomfort. You should actually lean into it and get comfortable being uncomfortable with what that evaluation reveals. And don't be afraid to challenge the usual way of doing things. Next slide. You also want to fix the leaky pipeline. In the medical space, we talk a lot about the leaky pipeline, and that is usually referring to minority students coming into the medical school pipeline, but then for various reasons, whether it's financial, lack of resources, they exit that pipeline before completing their program. But I think that leaky pipeline is applicable to all spectrums of the medical space, especially healthcare organizations when we talk about a leaky talent pipeline. So it's really important to understand where you are losing diverse, talented employees. Is that at the entry point? Is that at recruitment and selection? Are you only focused on certain universities or are you only focused on certain demographics? So to really look at those job listings, even the recruiters that you work with, are they, focused on diverse talent for you to see that talent? So really check those patterns and repeated practices. You also want to look at representation. I talked about this earlier, the importance of stratifying diversity data and not just looking at it as a whole or looking at it as one conglomerate, but really stratifying it and seeing where diversity is in different departments, different functions, different roles, different levels. For example, how many women in each department? How many people of color on your leadership team? Those are all questions that you should be asking if you want to increase representation in your organization. And then if you realize that your numbers are low, then set a realistic goal to increase those numbers in the next 6 months to a year. For example, maybe you want to increase the number of bilingual staff members to provide better care for non-English speaking patients. Or maybe you want to add 3 more Black people to your leadership team because right now you don't have anyone who identifies as Black, African, or African American serving in leadership or C-suite roles. So really assessing the demographics across your departments is really important. The next thing you want to look at is employee retention. Once people are actually in the pipeline, are you retaining that diverse talent? Because in short, if you are not creating that inclusive environment, you're going to make your marginalized employees who are going to be different than your majority employees not feel welcome, not feel valued, and more likely to leave the organization. So you want to improve your retention rates. Maybe you hold a focus group or one-on-one conversations. And this is key where your managers come in, ensuring that your managers are properly trained. And when they see employees who are disengaged, helping those managers re-engage those employees. And for promotion, you want to see who is, going through the corporate ladder, through the hierarchy. Is it one particular group? What other groups are not being promoted and developed, and making sure that all groups have access to equal professional development and resources to thrive in your organization. Lastly, you want to take a look at your pay equity. I mean, that is one of the most important ways to establish equity within your healthcare organization. Are people getting paid equally or equitably based on their roles and what they're bringing to the table? So really trying to identify those imbalances and course correct. Next slide. Okay, so training. This is actually one of the key areas that I'm very passionate about in DEI, and I know training gets a really bad rap these days because a lot of people feel like training is ineffective, but there are just as many people, including myself, who believe that ongoing training plays an essential role in changing organizational culture and individual behavior. So healthcare organizations should really focus on training to all employees on a wide variety of topics. I think a lot of people think, oh, DI is only implicit bias, allyship, and microaggressions, and that's it. But DI training is so much more than that, especially when you look at the healthcare space. So yes, you can talk about bias and how it impacts care. Maybe you cover it, you break it down. Maybe in one training you cover socioeconomic status. Maybe in another training you cover race and the sweeping assumptions people make, from mild assumptions, okay, all Black people can dance, to more problematic. Black bodies can withstand greater levels of violence and feel less pain than white bodies. And so when you do these type of racial bias trainings, that can show healthcare providers how to acknowledge race and other types of characteristics that they themselves may not have without letting that influence how they provide care. There's also allyship training for both colleagues and patients. And so the training can be broken down. What do we mean by allyship and allies? What are the barriers? How do we overcome that? Give real life scenarios. So if you all are on Twitter, I follow Med Twitter, which is extremely helpful because a lot of doctors are very active on Med Twitter, and a lot of doctors of color are very active, and they're sharing their lived experiences in real time, raw emotions about what is happening to them in these healthcare systems. And a lot of them are dealing with racist patients. So instead of denying that person's experience or making excuse for racist, the training would teach other providers, other people in that healthcare system to respond in an allyship-centered way. So instead of saying, oh, that doesn't happen, or I've never experienced, that patient hasn't been racist to me, say it's unacceptable. I'm gonna let that patient know that we have a zero tolerance and anti-discrimination policy here. And if they can't adhere to that, they can seek care elsewhere. I also report this to the chief physician and hospital HR. So that's a way to show how to be an ally. And so I've listed some other ways, trainings that healthcare systems can think about. Healthcare disparities, we talked about that in the beginning. Communication skills, we also talked about that. How to teach patients to follow, a healthcare regimen, plain language, verbal and nonverbal cues. So those are all different trainings that healthcare organizations can implement. Next slide. You want to bring everyone in, understand that DEI happens at all levels and all departments. It's very easy to think the DEI is only for the DEI or HR departments, but that's really the wrong way to be thinking about it. DEI is at all departments. So an example, consider having patient education materials available in multiple languages. Also consider the visual aids that you used. I have an example here where the Dallas Public Health Department recently apologized for using only Black men in their ads to promote the monkeypox vaccine. So you can see how that is rife with bias and racism. But if they had a DEI specialist or an officer on board, that may have not happened. Next slide. You want to establish commitment from your leaders. It's not enough that leaders are just saying, but they actually need to show a full commitment, because that's going to set the tone for the rest of the organization. Next slide. You also want to measure success. Tracking progress is key. If you're not tracking progress, you don't know where you've been and you don't know where you're going. So really understanding, whether your goal is based on hiring or retention or branding on it or employee experience, make sure you're doing regular monitoring and checking in and sharing progress reports with both organizational leaders and rank and file employees to assess how your company and your organization is doing when it comes to fostering DEI. Next slide. So the key takeaways, things that I've all stated and restated throughout this presentation, is that DEI really is key. And I would go so far as to say it's a matter of life and death when we are talking about DEI in the healthcare space. And so when healthcare organizations understand that, how DEI affects both their employees and their patients, then they can work to improve the workplace culture, and then they can work to provide better care. And that could look like improving communication, increasing patient satisfaction, and then ultimately delivering higher quality care. Last slide. So that concludes my presentation. I know I went through it pretty quickly, but if there are any questions, I will be happy to take them. Let's go to the chat and see what we have. Okay, Cecilia said it's extremely prudent to consider utilizing legal counsel to preserve confidentiality and encourage authentic responses in DEI audits and other related research. I totally agree with that, Cecilia. I'm legal counsel myself. I look at us as partners. I know a lot of the times the business people don't like us because we say no to a lot of things, but it's really just to protect the business and employees. So definitely look at your legal counsel as a partner in all of this. Gabrielle says she has to jump off, no problem. Okay, so I don't see any other questions. So I'd like to close the session. Thank you so much, everyone, for joining us. I hope you found this informative and engaging, and please enjoy the rest of the conference.